Run, river, run, run through the hills. Run, river, run to the sea. Run, river, run to your place beneath the sun. Run, river, run.
Hi, this is Jan Lewis. Welcome to Be My Guest. Today we have Eileen Davis with us. Welcome, Eileen.
Thank you.
She is the Vice President of Mass 211. We're going to tell you what that means. And the Director of Call to Talk. And I think that I read about this organization. And Eileen, it's all over the lot. They've been on Channel 5, 25, all the other ones. I think it was probably in one of the Worcester publications. It might have been in Metro West, because I get all the Sunday papers. But whatever it is, it caught my attention. This is to help people have the access to different organizations, such as for mental health. That really interests. What are some of the things that you do with it?
Exactly. Well, first, thanks for having me on
You're
your
welcome.
show. Really appreciate it. You're right. We're at the end of May, which has been designated as Mental Health Month.
Yeah.
And so forth. That's where you probably saw some of the clips and some of the media attention that's been on our organization. So first, I'll back up and help have the viewers better understand that Mass 211 is a statewide platform for all human service, social service needs that are available to people that live in the Commonwealth. Call to Talk is the mental health component of that program, and all of this is run by the United Way system.
That doesn't surprise me. They are fairly active.
Exactly. Many United Ways help promote direct services and promote the resources available to the geographic areas that they are responsible for in the state.
Now, Call to Talk. Does that mean that the person can actually call a certain number if they fear suicidal or something like? How does that work?
So Call to Talk, like I said, is the mental health component of Mass 211, and people can call and access the program by numerous ways. They can call it directly with a local 508 number. They can access it by dialing the National Suicide Prevention Lifeline number. And if that's really cumbersome to remember, you can actually just dial 211 from any phone. 211? 211, exactly, from any phone, landline or cell, and access it that way as well.
So let's see, somebody's feeling, well, they don't feel like they're going to get over to the ER. They feel like maybe they're panicking. Could be panic attack, suicidal, this type of thing. Just punch in 211. Then what happens?
Exactly. So a very highly trained volunteer call taker will pick up the call, hopefully in a very timely manner, and talk to you and listen to you about anything that's on your mind. Most people call us who are just looking for a place to turn is for connectivity, for someone to hear what they're going through and just sort of hear themselves think and process and maybe come up with solutions on their own. Some people might have some suicidal ideation and might be struggling at a little deeper level. And some people actually might be seriously contemplating taking their own lives. And the call takers are there to be there for them and present for them and to listen to them and validate their feelings in a very non-judgmental way. And hopefully at the end, de-escalate them a little bit so the person actually feels heard. And
You got to be a good listener.
You got to be a good listener.
The thing that I'm wondering about, in case somebody doesn't give their number or whatever, does their number automatically come up on a screen so that if you have to send an ambulance, you can?
Yeah. Well, we really try not to intervene with individuals who potentially don't really want that kind of service being provided to them.
Right.
But we help them understand that if they are in a dangerous, precarious situation, we help try to empower them to make the decision on their own, to accept our offer of support and help.
I'm thinking of somebody who, let's say there's a mother at home, her son or her daughter is completely lost it, maybe going psychotic, something like that, and they don't know where to turn, so they can call also not just the person who's experiencing the mental health situation, but someone around them can do 211. How is the phone answered? Does someone say hello, 211, or what do they expect on the other end?
So most times the caller can expect to hear the phone answered, call to talk, we're here to listen, and then the caller can proceed to discuss what's going on. That's the typical greeting that the person should expect to hear.
So now the Mass 211, okay, that's how that works. And it's Call to Talk. What are some of the organizations that they can, you have so many, right, that you could steer people to? What are those?
Well, Mass 211, like I said, has a plethora of information regarding all social service, human service needs. So the most basic and common requests are for callers who are concerned about food security, homelessness, food pantries,
right.
hot meals, shelter of some sort,
Sure.
utility help, childcare. Those are some of the basic overall.
Those are the basic ones. We're talking with Eileen Davis, and she is the Vice President for Mass 211, and she's the Director of Call to Talk. Now, they're together. They belong together. 211, Call to Talk. You're having a problem, an issue, you call them, and they're there to listen. How long has this been going on? I hadn't even heard of it.
Yeah, well, Call to Talk is in its 6th year of operation. Mass 211 has been around for quite some time.
I had never heard of it. I will pass that information on. There are many people out there that would like to use that.
Yes, the 211 call specialists are very well rehearsed in getting people access and connecting them to resources that they didn't even know. Now, sometimes when you are really stuck and you don't know where to turn, it just takes that little bit of a jump start to have somebody basically hold your hand and say, here's a place you can call, here's a place you can drop in, here's a website, these are the hours of operation, this is what you'll need to get these services and access these services. And
how do they get in touch with you, Eileen?
So again, any caller can actually dial 211, as Jan's been saying, and we can get connected. They can even connect you to me if you're interested in volunteering. Through email, or somebody can actually access, if you visit mass211.org, it will bring you to our website, and there on the website it will bring you to, you can navigate yourself and look for resources yourself, and we'll actually also provide you with a template where if you're interested in working, staffing, volunteering, getting involved with us on any level, get a presentation to your organization or your civic group, there's an opportunity to do so on the website as well. It's easier to remember because you just have to search for mass211.org.
That is fantastic. Now, you mentioned the magic word. I love it, presentations. If anybody out there would like Eileen to come and speak,
Sure.
You can speak about it. What about cases of, domestic violence is usually a 911 call. I'm trying to think, where does a person differentiate between, should I call 911 and get the police over, or should I call 211? I'm not sure. What would you suggest?
I would suggest that anybody call 911 if you are concerned about your safety. Safety is the big underlying barometer of what to do. If you're looking for information and it's a non-emergency situation in that moment, then 211 is probably appropriate to save the first responders for real life and death emergencies or potential transport to a hospital or an ER.
Do you cover, we're out in Upton in the Milford area, do you cover all these general areas? You're based in Framingham,
We're
right?
based in Framingham, however, we are a statewide program.
Oh, it's statewide.
So
good.
anybody from North Adams to Nantucket
Can call.
can actually call, yes.
Are the local hospitals and other facilities aware? They're aware of this?
Hope so.
I hope, yeah, it would be great. I mean, the person calls that I was just told, was suggested to me by 211, Call to Talk, that I can connect with you.
Yeah.
What happens if the person is so depressed they can't make the call? Or so? You can tell probably on the phone. What then?
Well, again, it's only really going to work. The next step is only really going to work if the caller is invested in the option.
Yeah.
So we try very hard to help them understand what would be a logical next step.
Yeah.
And that's why calling the 3 digits can be so much easier than remembering a long number.
Yeah.
Because you're right. If you really are stuck and you're really struggling and you have symptoms of depression, it could be even hard to dial a phone number.
Yeah, I can imagine. When you give presentations, where have you been going and where would you like to get out more?
We're happy to go anywhere. Myself or a member of my staff or a combination of us are happy to go to schools, like you mentioned, hospitals. There's oftentimes other providers that are looking to have us in there. So it could be a provider that's responsible for any type of clinical setting, Maybe they have clients that are in need of, because oftentimes if you are struggling with a mental health concern, you probably also potentially have another underlying concern.
Could be an addiction.
An addiction, like you mentioned, domestic violence, or just like we talked about earlier, just basic human service needs, food, shelter, childcare.
Like if somebody calls in and they're very lonely, you tell they're depressed and anxious, anxiety, and they're running out of food. Let's say they have the food stamps, but it's like people who have the food stamps, you feel like saying to the state or whatever, "Can you spare it?" I mean, really. I had a friend that was on them. She got, I don't know where they goofed, but $10 a month. I was like, "What's the point?" Finally, she got it straightened out. That it was supposed to be much, much more than that. And I'm like, "Oh my God!" But they wonder about it. Like I run out. I've done this and I've done that. And you will help them find places around, like food pantries.
Yeah, we'll do our best. I mean, sometimes we don't know everyone's situation, but if they present some of their basic income, we can help them at least get an idea of what they might be eligible for, and send them over to maybe even some other cash assistance programs that might be able to help them.
Yeah, how many people do you ever find? You say, go on over to the Social Security Administration and apply. Let's say that they're totally disabled and they don't know what to do. Go over there and see if you can't get on SSDI or SSI, which is, I'm not lying, that is a challenge. They make you jump through hoops. Mm-hmm. But here's the good thing I found helping others was that your state rep is free. Sorry, lawyers, but it's true. You don't have to pay a lawyer. Go to one of your state reps. That's why they're here. I had to do that with a friend of mine. He got that thing through, he passed it through, and he'd been turned down twice. The man had been turned down twice and needed it. The state rep walked it through, it went through. Again, it's a free service, and I'm all for it. Really, I mean, they make, it's kind of crazy some of the paperwork they make you go through. And some people get overwhelmed.
Yeah, it's hard. Things are really hard.
It's tough. So in other words, somebody out here in Upton or anywhere can call 211. Call to talk. You're feeling depressed, suicidal, anything else, like, we don't have enough food to make it, where do we go? How about things like medical care? Who would be the best doctor? Some people don't know. The best doctor, psychologist, who would you get, hook up with?
Yeah, there are some services statewide that help connect you to medical physicians or mental health physicians or therapists or clinicians that can help you with that, depending on your insurance or if you have insurance or if there's a language component. So we help connect people. We don't actually have a directory of physicians active, but we do have a directory of the services that help connect you. And if you have a particular need or a particular mental health concern, these registries have specialties that the clinicians are registered under that we can help connect you with.
So in other words, if somebody lived near UMass or whatever in Worcester, whatever, out here, you could connect them. How about Riverside, right up the street in Upton? They're terrific.
Yeah, Riverside is wonderful.
Are they on? Are they know about the 211?
Yes.
Oh, that's good. Okay, I think a lot of people, they're aware of that. They do have up there a 24-hour emergency hotline or something. But I'm thinking also it's good to know 211 is there to help as well. How many people do you think you help per year or per month?
Oh, I'm certain that it's many. Over the course of a year, we receive over 150,000 calls, and people also visit the website as well. So, and there's a trickle effect. There's a ripple effect. People talk about it, they tell each other, just like what you're doing right now. Very helpful. Get
the word out. Do you have flyers that you post? I haven't seen any.
Yeah, we have some collateral material. A lot of what we have is on our website. Yeah. It's available for download, so you can print it and distribute it to your communities.
So you can do that.
You can do that as well.
How long have you been doing this, Eileen? What got you into it?
It's really hard to say when you've been doing something for so long. I've been involved in crisis management services and with volunteer organizations my whole professional life, so it's over 30 years. I've been heading up Mass 211 now for over a year. Love it, and really happy to be able to take the extra step and not just stop at, but not just work with the mental health component, but the whole array of what a person needs, to be a holistic approach.
Yeah.
So that's really.
Did you know you were
really
going to do
been
this when you
rewarding.
left college and the high school? Did you know?
Probably not. I mean, I was always interested in one of the helping professions, but I truly adore this because not only are there so many people that we can help that we will never even know, but the people that do this work, the call takers on the other end, the staff, the professional staff, and the volunteers that take the mental health calls, they are individuals that enrich my life so much, and they're just so amazing themselves that I feel I'm a super lucky person because I get to come to work every day and surround myself with those types of individuals.
They're professionals. Now, are they volunteer professionals? Are they volunteers just like people and regular people? How do you get a volunteer in there?
So our services have a combination of professional paid staff and volunteers, all of which are very highly trained and monitored. And it's we get a lot of people from word of mouth. A lot of people who provide our services actually tell their family and friends about it and recruit each other, which is wonderful. But, you just never know how you're going to...
All different age volunteers, right?
The whole spectrum.
Okay, now Eileen, how would they get in touch with you again if they would like to volunteer?
So if you would like to volunteer and you were interested in perhaps joining us at Call to Talk, again, you can visit us at mass211.org and select the Call to Talk option. You can also visit Call to Talk by visiting United Way of Tri-County, and there is a selection for Call to Talk there as well. We are housed in the United Way of Tri-County building, so we are under their website as well. Like I said earlier, the United Way system does support Mass 211 and Call to Talk.
Now, you're based in Framingham.
Yes.
Should people connect with you as you've been saying, or could they go in person? I mean, it's the ones who would like to volunteer.
Yeah, it's probably best to make a phone call or connect online first, just to make sure that someone is there. I mean, obviously I'm here right now, so it wouldn't be a good time. And I am in the community a lot as well. But we also have staff that can support the recruitment of volunteers and provide information as well.
Did you want to give your email to, or not? They can just get through to you.
Yeah, you can find my email there. I mean, it's kind of long to say it right here, but I'm happy to provide my phone number. So my office number is 508-370-4857, and that's a direct line to me at my desk.
And Eileen, you are the vice president. How long have you been vice president?
So like I said, the job, that component of the job is fairly new to me. I've been in the job for a little over a year now, and I've been at Call to Talk since its inception.
My gosh, so you saw it. Were you part of the team that invented it, that founded it?
Yeah, I'd like to say that, the Call to Talk component, again, with the management and the directorship of the United Way of Tri-County did endorse and support, making it live and giving it a home and giving it space and supported me in my initiative to bring it there. But I was the first director and got it up and going,
Now, what's the next step? Will you be staying there and moving up to president, do you think, or what do you think?
I'm very happy where I am right now. I have a wonderful boss. He's the president of the United Way and the executive director of Mass 211. His name is Paul Mina, and he's been wonderful to us. But I'm very happy where I am. I think we have got a lot, sure. Is our call volume growing? Yes, our call volume grows every week, every month, every year, exponentially. So we need volunteers. We need donations to continue to be able to grow, to have the technology and the space and the recruitment and the training efforts stay alive and robust enough to sustain the growing amount of calls. The calls volume is not going to go down. So where do we go from here? Is we continue to be a reliable, trusted place in the community where people can turn.
How do you get a volunteer to be awake and aware overnight when the calls come in? That's tough.
I don't make them. They have this intrinsic ability to want to do it and to be there. And it's a rare commodity, and I think it's hard to find, but those individuals are out there, and we're all the better for that.
Well, Friendly House in Worcester, they know about it, right? Do they know about the 211?
I hope so.
They do. Also colleges. I know when I was in college, there was a girl, I had no idea. She was very depressed. I had no clue why she left. And it spooked me out because I thought, why didn't she tell me?
Mm-hmm.
I was not a professional, but I was a good friend. And I thought, why not share it? It must have been very scary. She was from out of state.
Yeah.
That's scary. What about like Clark and WPI and a lot of these colleges? Do they know about your service?
Yeah, I hope so. I mean, each college and university does have a counseling center where mental health services are provided. But I know in our own backyard, we have Framingham State,
Yes,
and even the high school, it's very overburdened with mental health walk-in.
And they're not open 24 hours 7.
Right, exactly.
No way. So then, some kids are, maybe the addiction is they're pushing them over the edge, and they need to talk to someone like at 2 a.m. And you don't know what's going to go from there if they can't reach another human being. Maybe they can't get to the emergency room. And I noticed, unfortunately, some of these emergency rooms, they kind of like treat them and street them. They don't even treat them. They kind of house you there for a while. I took a friend up the street to Milford. Nothing against Milford, but I get that's about all they can do. They just kind of watched her for a while, and then they sent her home, and I took her home. I'm thinking, I guess that's about it. What do they do? Refer them to someone?
Yeah, I mean, hopefully they'll refer them to sort of a step-down situation where if they're not currently engaged with a clinician or a counselor of some sort, that they can help at that point to match them up with an individual.
It felt strange to me. I mean, I think a lot of us think, if you go to the emergency room, they'll be able to help you right then and there. They didn't do anything wrong. It's just that finally they came out and said, would she like you to come sit with her? Fine. So I went back in there and I sat with her. I'm looking at the room. I'm like, if I was super anxious and depressed and I looked at this room, there were no pictures. I don't think there were any windows. A cot. I'm like, This, I would think that's the opposite approach that you need, isn't it?
Yeah, well, they're not meant to be a long-term solution.
Yeah.
I mean, if you think about it, I'm sorry for your friend and what happened, but it took a while to get to that place. So it's not necessarily that, an overnight or an afternoon that's going to be fixed. I mean, it's the first step.
Yeah.
So as long as the other steps fall into place, it's kind of like dominoes. You need everything lined up. And that's why the next steps are really what's important. The hospital visit or the emergency room visit is a piece of that. It's a first step.
Do the hospitals ever call you? We have a patient here. Do they call 211 and say, what would you suggest, or do they know already?
Yeah, they don't typically call us for a consult, but we do our best to help them understand some of the resources that are out there if they don't already know.
Yeah. So now, Friendly House, I was thinking about that over in Worcester. That's a great. I can't. What's the name of the gentleman who's run it for years? I think he just got an award. Oh, I think I've even interviewed him years ago. But he is amazing. Mm-hmm. He has run that for years. I want to think of somebody. What about shelters? What if somebody? Well, I don't know how many shelters are open out in Worcester now, but do you ever get someone who says, "I've been locked out or kicked out. What do I do?" Mm-hmm. Can you steer them?
Sure. I mean, emergency shelter is quite a significant request that people are looking for. It is challenging. A lot of the shelters get full, especially in the the weather,
Winter,
extreme, and even in the summer when it's really hot. And sadly, if it's a family, that can be tricky too. And again, if substances are involved, that can be hard as well. But we do our best to provide resources for that as well.
Yeah.
Look, we can just do what we can do. We can refer and give the information out. Hopefully there's space.
If somebody is extremely drunk or drugged, whatever, do you refer them right off to AdCare? Or what do they try? 1-800-alcohol? Or do you just say, just go? You can't go over to AdCare, just walk in, I don't think.
Yeah, I mean, there's a difference between programs and immediate shelter.
Yeah.
Especially if someone is homeless in the moment and needing...
I mean, if they know that they finally hit bottom and I gotta need help and they're real sick, do you refer them to someone at AdCare or anywhere else around here?
Well, again, don't forget, we cover the state, so it just depends where they're calling from. And we ask people, when they call to give us their zip code from where they're calling so that we can help guide them in that.
Oh, that's a great idea, because there's so many. Before we close, Eileen, one more time, how can people reach you about 211, call to talk?
So again, to reach us, you can visit mass211.org and navigate our website to find information on any resource in Massachusetts. You can have a guided search where you can select the category of interest that you're looking for, and you can simply dial 211 and our auto attendant will direct you to the extension and the area of need that's most appropriate for what you're looking for, including call to talk.
Aha, this is great. Again, you want to call, you need to talk, doesn't care what time of the night, 211, it's free. If you're feeling suicidal, depressed, anxious, something else is going on, you need to talk. They can help you out. They can refer you at no cost.
And please, it's free, and please, if you're thinking about it, just try it. Just call it, try it out, and you don't even have to say anything. You can just hear what the person sounds like, and, until you feel comfortable talking. But it's so much better to reach out than to be by yourself and struggle alone silently.
Definitely. We need a lot of things. We need help. You covered the state of Massachusetts.
Yes.
Are there other 211 places in the country at other states?
So most states do have a 211, if not all of them.
Oh.
Not all of them are statewide. Some of them have multiple. They're divided by county or geography.
Sure.
But here in Massachusetts, it's one office, the whole state.
I think, do you get to high schools and give presentations?
We can, sure.
Oh, see? I think that would be great. Thank you, Eileen, for being
welcome.
with us.
Thank you.
You're welcome. See you next time. God, that is amazing.
Riding on a shooting star, heading out toward a dream.